Everyone. Uh, this webinar is going to be recorded.
Victoria, we can't hear you.
Yeah. No. Good now?
Yep.
Okay. Okay, so as we're gonna get started and we're waiting for everyone to get in, I'm gonna light a smudge for us today, just so we have a good a good session today. We open our eyes to seeing what we have to present and our minds for new perspectives as we work towards reconciliation day tomorrow. So just take a minute to just clear your mind and center yourself this morning, because we're going to go forward in a good way this morning with each other. And we're just going to take a minute to just to recognize and to keep all the children in our hearts. Pray for healing for our communities and for Canada as well. So as we're going to move on to our land acknowledgement here, and my beautiful colleague Laura Lee is going to do our land acknowledgement.
Good morning, everybody. As part of reconciliation, it's important to acknowledge the ancestral lands on which we stand. We do not use treaty acknowledgement due to the fact that some lands have been never ceded or treaty agreements were never made. So please honor the land that you're on.
Okay, Buju Anin, Mino Gijigut, Mino Gabakwe, and Dishnakas. Welcome, everyone. I'm Victoria McKay. I live in Rolling River First Nation. It's in Manitoba. I don't know if we have any fellow Manitoba participants here today, but maybe if you guys can just in the chat let us know where you're joining us from, what territory you're joining us from. I'm a mother to 5 adult children and grandmother to 2. I've worked as education liaison with SE Health for the last just over a year now, providing cultural safety trainings, this reconciliation training, more mental health pieces. I have a Master's of Education in Guidance and Counseling, and I'm a Canadian Certified Counselor with the CCPA. And it's good to see, I see someone from Thompson joining us. I have a private practice in equine therapy, as you can see in my picture. I'm out on our land here, just in the back field, riding my horse with my husband. So that is me, and I'm excited to join all of yous today. And I really appreciate each and every one of yous for joining us today. Over to you, Laura Lee.
Thank you, Victoria. I just want to acknowledge that I am situated on the traditional territory of the Algonquins, the Pikwakanagan First Nation, and the Algonquin people have a long-standing history in this area. And I live in a town called Petawawa, and it originated from their language. Specifically, the Algonquin people are recognized as the customary keepers and defenders of the Ottawa River watershed and its tributaries, which include the Petawawa River. And I thank them for their stewardship of this beautiful land. I'd like to acknowledge that Natalie DeFibio was to be here today, and unfortunately she wasn't able to attend, so I am subbing in for her. I'm a nurse for 37 years, a registered nurse, and I have a passion for palliative care and end-of-life care. I'm a proud wife and a mother of 2 grown children. I have children in Saskatchewan and Alberta. And thank you very much for having us here today. I'd like to take an opportunity to introduce you to Elsie Zhang and Suzanne Stevenson, who will be our tech support today. And they're just going to do a brief introduction themselves.
Hi, my name is Elsie. I'm an education coordinator on the team and I'll be tech supporting. So if you have any questions, drop them in the chat and I'll let Suzanne introduce herself as well.
Thanks so much, Elsie. Hi, everyone. My name's Suzanne. I am a project manager with the team. I am also here doing tech support today. So certainly, as Elsie said, feel free to reach out to us if you have any questions or need any help. Back over to the presenters.
Thank you very much. So today we're exploring reconciliation in healthcare and a journey that calls on both Indigenous people and allies like myself to reflect deeply on their roles in fostering meaningful change. It isn't just about policy or practice, it's about the 5 Rs: relationships, respect, relevancy, responsibility, and reciprocity. As allies, we must understand our position and privilege and commit to learning about Indigenous voices, from Indigenous voices. For Indigenous people, this is also a space to reclaim and affirm traditional knowledge systems that have long supported wellness and community care. And let's take time to examine our own Indigenous knowledge, whether inherited, learned, or lived, and assess how our actions contributed to culturally safe spaces. Reconciliation in healthcare means moving beyond acknowledgement to action. It means embedding cultural safety, humility, and accountability into every layer of our work. So we want to welcome everybody from all over the country, coast to coast to coast. Today, we're going to walk through 3 key areas that are essential to advancing reconciliation in healthcare. Understanding the roles as allies and Indigenous people. We will begin by recognizing that reconciliation is a shared responsibility. Allies play a crucial role in listening, learning, and amplifying Indigenous voices, while Indigenous people bring lived experience, traditional knowledge, and leadership to this work. It's important to reflect on where we each stand and how we can contribute meaningfully. And we'll look at this in a more detailed and take time for reflection on this. And I can't stress enough that it's not the responsibility of Indigenous people to teach us. It's a responsibility of everybody to learn. Reconciliation isn't just a concept, it's a call to action. You'll hear the word reconciliation, and this emphasizes the need to move beyond the words and into practice. And that means challenging systemic barriers, advocacy for equity, and embedding cultural safety into our everyday work. And you can start by asking yourself, what does action look like in your role? And lastly, we will examine our own Indigenous knowledge and actions. What Indigenous knowledge do we carry and how do we apply it? This is a moment of honest and self-assessment and growth. This presentation includes content related to anti-Indigenous racism, systemic discrimination, and historic trauma in healthcare. And some material may be distressing or activating, especially for those who have lived experiences. So please take care of yourself in whatever way feels right. Step away, pause, reach out for support. Your well-being matters. Let's begin with this powerful quote from the late Honorable Justice Murray Sinclair. Education has gotten us into this, and education will get us out of it. And this statement speaks directly to the legacy of the residential school system, a system designed to erase Indigenous identity, language, and culture. For over a century, Indigenous children were forcibly removed from their families and placed in institutions where they experienced profound trauma, abuse, and neglect. And the goal of assimilation and the impact has been intergenerational, and it will continue to be felt today. Many Indigenous people today are working to relearn their language, reconnect with cultural practices, and heal from the deep wounds left by these schools. This is not just personal work, it's collective, and it requires support from everyone. Understanding reconciliation means understanding the historical and legal context, and that includes treaties, and we heard about this in our first session. These are nation-to-nation agreements that must be respected and upheld. Land claims recognizes Indigenous sovereignty, and the right to land is central to justice. The Medicine Chest Clause, found in Treaty 6, it affirms the right to health care, a right that must be equitable and culturally safe. The right to education, not just access, but education that reflects Indigenous knowledge, values, and history. And the late Honorable Justice Murray Sinclair reminds us that education was used as a tool of oppression, but it can also be a tool of liberation. And as educators, healthcare professionals, and allies, we have a responsibility to ensure that learning leads to truth, healing, and meaningful change. I'll hand over to Victoria.
Okay, thank you, Laura Lee. I appreciate all the words that you shared, and I'll be reflecting back on some of the things that you've said. So I wanted to share just a story about this weekend. The reason I'm sharing in this way is because in our ways and in our protocol, our histories were very were oral, right? So we learned from one another, and stories were passed down. So I just want to share a little bit of an experience that I had actually yesterday. So this is me and people in some of our Manitoba people that I see in the chat will probably know this area. It's Tutanauzabeing, just north of Riding Mountain National Park here. So me and my husband, we're riding the bikes, and we passed this, and my husband pulls over and he goes, "Hey, do you want to go back and we'll take a picture by that by the big dream catcher?" So we turn around, we come back, and we're taking pictures, and then a truck pulls in, and I got a little scared for a second, right? Thinking, "Oh my gosh, we're gonna get in trouble." It turns out it was the chief, Barry McKay from Tutanauzabeing. So he stopped and he chatted with us. He welcomed us to his territory there, and was telling us about the land, where this site is here, and he appreciated that we stopped in there to take some pictures. So as he's he's talking and we're listening, he's sharing some stories about his elders in the community, and he talked about some of the treaties as well. And the one thing he said was, "We're here because of the treaties, and we need to understand those treaties so that we can move forward." And with a lot of our oral stories, and when we talk to elders, we often we listen, and then usually a day, 2 days, maybe even a week later, we start to really reflect, and then it kind of clicks and makes sense. And it was just really neat that he just happened to stop and talk to us about this, and we were just when I was preparing to do this session today. But he also shared his story, and I just want to share it because he talked about the elders in his community. And it just shows that all our communities were connected, but yet we are so different, right? So he shared that one of the southern or south communities, Kisikunen, sent up some buffalo meat up to their community. So he took the boxes. He went to the elders, and the elders said, "No, we don't want that. Uh, like we're not going to eat buffalo." And he said he was a little confused, and so he asked, well, why? And they said, well, because that's more of a Sioux food, right? Because Nels being there a little more north, right? A little more towards in the bush, right? And the traditional foods are like moose and elk that are up in that area. And I just thought that was really neat, in the sense that we do need to listen to our elders, right? To learn some of those teachings from before, some of those teachings that we've lost along the way. So that's a there's a lot of history in just that story that he shared with us, and that our landscapes were different back then, right? What we ate was different back then, and we need to take the time to to speak to our elders, to sit with them, to listen to them, right? So I just wanted to share that story, just to really show that our histories are oral. As an Indigenous person myself, I continue to learn every single day, and I do try my best to spend time with our elders and really listen to what they have to say, because what their stories that they share with us, we can pass those on. We can pass those on to to our children, to each other, and it's really important that we continue that oral tradition of sharing our stories and listening to one another. So I move on. So understanding how we got here, I just want to reflect on the previous sessions that our wonderful colleagues taught with us with session 1, 2, and 3. So the historical impact of colonization, we learned, really about the treaties, right? And we were encouraged to learn more and really understand, uh, that policy created the situation in terms of the residential schools, the Indian Act, right? And so we're going to be talking really about how do we move back, or how do we move to reconciliation through examining policies, right? And policy reform. And so that it's really important that we understand those treaties, the Royal Proclamation, the Indian Acts, and how that impacts us even still to this day. And the race and racism in healthcare, understanding our biases, how our biases are created, the intentional and unintentional racism that we face every single day, examining the racism in healthcare, and just identifying overt and covert racism in healthcare. As an Indigenous woman, I see things through that Indigenous perspective, right? Whereas my colleague Laura Lee sees things, from her perspective of a non-Indigenous ally, right? And sometimes we need to come together to speak, to talk to one another, to share our stories, right? And Laura Lee has a story that she's going to share with us a little bit later, in terms of a situation she had, right? And so it's really important that we share our stories, right? And then in session 3, we had Tyler talking about cultural intelligence. And I'm sorry, everyone, that we don't have a Kahoot today, because I know everyone had a lot of fun doing the Kahoot. And just and then they led into moving towards allyship and what that looked like. So today we're just going to put all that information, hopefully tie it all together, so that we can really look at how are we going to move forward, as Indigenous people, as non-Indigenous people, as healthcare, education. How are we going to put all this information that we're getting, and how are we going to use it to move forward in a good way, right? So I have a video in the next slide here, and this is it's about where are we now, right? So this video was done 6 years after the TRC was put out. So what I'm going to ask everyone to do is just watch, and anything that pops out to you, put it in the chat and share. Okay, go ahead, Laura Lee.
In my view, the justice system's been incredibly destructive. The doctrine of discovery, in a lot of ways, has served as the legal justification for dispossessing Indigenous peoples of their land. I very often encounter federal or provincial governments who effectively are looking to deny the existence of Indigenous title and rights. And I can tell you that this approach is completely unhelpful to reconciliation. You know, despite all of the great work that was done by the TRC, as we know, questions are still being asked about whether all of the relevant documents are obtained, and the government still seems to be dithering to some extent on fully implementing the recommendations. I think we as a society must be able to come to terms with the sort of the full and unvarnished truth about these issues in order to move forward.
I think we can definitely say that we've made progress in some areas, while in other places we might have stalled. Not creating health infrastructure near Indigenous communities, having people come into environments of care where they don't feel trusted. You know, these are all healthcare rights that we don't think about. When I first came in as a leader almost a decade ago, I sometimes felt like I was off to the side, just commenting on Indigenous health. But the effect and impact of the TRC is that I found that there's been a transition where, you know, you're just a voice with a special, you know, lived experience, but that lived experience, it lateralizes across a lot of different areas. The disempowerment that Indigenous communities experience, it's a magnification of all the things that we're not necessarily doing right in health. National Indigenous Day is a great opportunity for us to reflect on the role of Indigenous peoples in the founding of this country. On the 22nd, that's where we see whether or not any of these conversations had any impact.
The quote is something like, "Education got us into this mess, education will get us out." In BC, we are really lucky to work under a curriculum that mandates K-12 integration of Indigenous worldviews. Specifically with residential schools, I believe it comes up in the curriculum in grade 5, 9, and 10 social studies. Aboriginal education is everyone's responsibility. And although we're on that path and we're making progress, we still do have a long way to go. I think on June 22nd, collectively as a country, as a province, as a parent, as a sister, we keep taking these steps forward. Reconciliation is not a one-day event. Celebrating Indigenous peoples in Canada is not a one-day event. It is a journey moving forward.
Okay. So with that video, you know, we see that it's a journey, right? It's a journey towards the Truth and Reconciliation calls to action. We do see that, you know, we are making some progress, but we still have a ways to go. Was there anything that anyone wanted to comment on that video? You can just put it in the chat. So colonization, this is a study that was done, and I liked the framework here, right? It really shows you know, that the Indian residential schools and the Indian hospital system, how they impacted the loss of culture and language, loss of land, and just the one-eyed seeing approach, the interpersonal racism, systematic racism, and epistemic racism. And then how that filtered down and into unsafe health spaces, engagement, trust, and access, and then the negative impact on mental health, socioeconomic status, and risk factors. This specific study was, they were looking at cardiovascular outcomes, right? And we know that cardiovascular diabetes, you know, all our health really focuses around our well-being in terms of our heart and our breathing and our overall well-being and mental health. When we don't trust in a system, we're gonna be real tentative towards going to the doctor, right? Because of the engagement and the trust and access that was lost. So I found this this framework here just a really neat way to really look at it on how it impacted the different pieces, impacted right down to our health right now. So really we're looking in terms of reconciliation into creating the self, working our way back up, right? Creating engagement, trust, and access, right? Increasing our mental health, our socioeconomic economic statuses, and reducing the risk factors, right? And also then, moving up, right, towards the regaining our language and our culture, addressing the land and environment issues, right? Really looking at a two-eyed seeing versus a one-eyed seeing approach, and addressing the racism both at the interpersonal level and the systematic level, right? So next slide, Laura. Oh, and I'm just gonna the chat here. Yeah, so not much progress on the calls to action by the Canadian government. So there's different, some people will say, and I looked this up, how many calls are actually been completed, right? So there's 13, there's 15, and there's 16, right? I couldn't find an actual number. It just depended on what they were assessing in terms of the completion piece of it, right? Um, so in 2015, so in 10 years, between 13 and 16 calls to action have been completed, right? So that leaves probably 80 some that are still in progress. So as we can see, reconciliation is going to be a long journey for all of us, and we need to just keep an open mind, listening to one another, and really using our mind, right, to assess the information that we're putting in. So policy. So a lot of the times, we have policies, and people are expected to fit the policy, right? And we're expected to adhere to a foreign policy that sometimes isn't always culturally informed. We did a presentation not too long ago, probably back in June, and they wanted to know how to work with the Indigenous population in their area, because there was a certain policy that they were having a hard time adhering to, right? And they didn't want to, to risk losing their practice or their license. So they really wanted to know how to work with the Indigenous population, right? So as we went in, we did our presentation, right? And we were talking with them, uh, and and I said, well, are other people, other agencies or organizations having the same issue? And they said, well, I don't know. Right. Okay. Well, I said, if you're having, this issue with the policy, maybe there's other organizations that are having the same issue. Maybe the issue isn't with the people, maybe it is with the policy, and maybe the policy needs to be looked at so that it fits the people and the practice and for it to be culturally safe and sensitive for that population. And the light bulbs kind of went off, and they're like, can we do that? Absolutely, right. As allies and advocates, if a policy doesn't feel right, feel that it's culturally safe in terms of the practice that's being provided for the people that we're working with, um, look at the policy, right? Look at advocate for its change, right? So that the practice, a culturally safe practice, is reflected in the policy that's there. So looking at, possibly changing some of the rules and laws or organizational policies so they better fit for a fair, equitable healthcare for Indigenous people. When we're really looking at the policy reform, get your microscope out, have a look at it, right? Is this working, right? And if it's not working, then, advocate for some change. Why isn't it working? Because you'll have to have why it's not working in order for policy to be reformed. Look at Indigenous-led program development, creating health programs that are designed, led, and guided by Indigenous people, ensuring that they reflect the Indigenous values, needs, and knowledge. And then cultural safety training for all staff, teaching healthcare staff to understand and respect Indigenous cultures, histories, and experiences so patients feel safe, respected, and understood when receiving care. Address racism in healthcare settings, taking real action to recognize, prevent, and respond to both overt and subtle racism that Indigenous patients experience in hospitals, clinics, and other health services. Addressing culturally safe spaces for Indigenous people accessing healthcare. Identify and change practices, environments, or attitudes in healthcare that make Indigenous people feel welcomed and respected. And then valuing cultural practices for improving health outcomes, respecting and including traditional healings, ceremonies, and cultural practices as important part of overall health and wellness alongside Western medicine. And we do see this happening in healthcare settings with safe smudging spaces, Indigenous patient navigation services. So there is a reform happening right now, right? And next slide. So I've got a couple of articles, and these are from this year. And those that are in Manitoba will probably remember this post that was done by a nurse kind of north of Selkirk in the Interlake region. Posted a really racist comment on social media. It was immediately within a day or two. It was reported to the hospital, the health region. I believe it even went to the association. But this here, it's it shows that racism is still alive and well, and we don't need to go far to find that ideology that exists, right? I don't have TikTok anymore because I was getting way too frustrated with reading all the comments that showed real racial kind of underlying attitudes. But the Interlake region, they actually let this nurse go over the social media post saying, an immediate investigation they did, and the posts of this nature are deeply hurtful, and they remain committed to reconciliation and anti-racism and mitigate further harms through swift and decisive action. So they use their policy here in terms of supporting and taking a stance that this is not acceptable, and they let the healthcare worker go. And this next post here from August 20th, so this is just probably like 3 weeks ago, there was a young woman in emergency having going through anaphylactic reaction, and only to be met with racism, invalidating what she was going through, right? Assuming all sorts of things as a young Indigenous woman coming in to get health care, right? And she stated it, this isn't just negligence, it was racism in healthcare, and it could have cost her life. And in the second series that you guys attended, there was even more examples of that continued racism in healthcare, right? So, this is an example of reconciliation in terms of addressing racism, but we know that it still exists, right? So we do need to make sure that we're seeing, both things, right? We definitely want to hold up the reconciliation pieces that we see happening, and continue to advocate for those around us. Laurelie?
Thank you, Victoria. The Truth and Reconciliation Commission of Canada is rooted on the legacy of the residential schools, Indian residential schools, and the demand for Indigenous peoples for truth, accountability, and healing. We went through this a bit in session 2. It was established in 2008 and chaired by the late Honorable Justice Marie Sinclair, alongside Commissioners Dr. Marie Wilson and Chief Wilton Littlechild. And it had a mandate to document the truth of the survivors, educate Canadians about the history and ongoing legacy of residential schools, and promote reconciliation and healing. And there's a couple, we just want to bring some healthcare calls to action that we think are notable. And it is quite saddening to know that only between 13 and 16 of these 99 calls to action are even being met. So 18 recognizes healthcare rights of Indigenous people, and this call urges governments to acknowledge that Indigenous people have the right to equal access to healthcare services. And as we've seen in international agreements with the UNDRIP and the rights of Indigenous people, 19 identifies and close the healthcare gaps. So these actions focus on collecting and using data to understand and eliminate disparities in health outcomes between Indigenous and non-Indigenous populations, including chronic disease and mental health. And we know that there's substantially higher levels of chronic disease and mental health within Indigenous populations. Number 20 addresses distinct and health needs of Indigenous people, and it calls for the recognition and accommodation of the unique health needs of First Nations, Inuit, and Métis communities, including culturally appropriate care and services tailored to their specific circumstances. There's some movements where Indigenous people are within hospitals, and they have, as part of their Indigenous patient navigation, where they go in and they provide them with traditional foods to help with healing, etc. Provides sustainable funding for Indigenous healing centers, and this call emphasizes the need for long-term financial support for community-based healing centers that address the legacy of residential schools and promote Indigenous-led healing and wellness. Call to Action 22, recognize value of Aboriginal healing practices. And this call asks healthcare systems to respect and integrate Indigenous healing practice and to allow elders and healers to work alongside medical professionals to treat Indigenous patients. That two-eyed seeing approach. 23, increase Indigenous representation in health professions. It calls for efforts to recruit and retain Indigenous people in healthcare careers to ensure culturally safe care and improve representation in the healthcare workforce. And this is so important. And, you know, we have a scholarship. We're currently running a scholarship to help Indigenous students with their education expenses. And if anybody wants any information on our scholarship, they can go to our webpage and find out more information, and it is open until October 31st. Call to Action 24 requires all medical and nursing students to learn about Indigenous health issues. And this action mandates that medical and nursing education include training on Indigenous health history and impact of colonialism to better prepare future providers to serve Indigenous communities. I've been a nurse for many years, and there was never any Indigenous education provided within my nursing program. I think this is extremely important that we need to have this within the system, within the education system. So reconciliation is reconciliation. And we're just going to talk about the past, the present, and the future. So Section 35, in the past, Section 35 of the Constitutional Act of 1982 affirms Indigenous and treaty rights, including access to health education. And these rights are foundational to reconciliation. Treaties like the Medicine Chest Clause explicitly recognizes the rights to health care. Historical exclusion from demographic participation. Indigenous women gained the right to vote only in 1960. It seems crazy that it was only that many years ago, and men earlier, but only by giving up status. These systemic injustices shape the inequities we see today in healthcare access, outcomes, and trust. In the present day, Indigenous patient navigators are within the hospital and the healthcare system to help bridge gaps in care, and they're offering culturally safe support and advocacy. There's cultural integration includes smudging ceremonies, elder consultations, and medicine wheel teachings, supported by policies like the Unity Health Smudging Protocol. Traditional food options, example bannock and wild game, are being introduced into hospitals to support healing and cultural identity. Safe spaces for ceremony are being created within hospitals. And this is designed with Indigenous elements and support by trained staff. And that's all part of, the importance of cultural safety training so that people understand the importance of these ceremonies. Symbolic initiatives like Bill Bannock, they help make healthcare spaces more welcoming, but must be paired with systemic change. Racism, bias, and stereotyping still exist, and patients may experience longer wait time, dismissive care, or harmful assumptions. Cultural safety must go beyond surface level efforts. It requires deep, sustained change at both organizational and at personal levels. So what does the future look like? Full implementation of the TRC calls to action, especially those related to healthcare. Healthcare systems are reformed to close the gaps in access, outcome, and experience. So we don't see those high numbers of chronic disease and mental illness within Indigenous people. They're more comparable. Indigenous-led governance and policy development become standard practice. Racism and bias are actively dismantled. That there's culturally safe care is the norm and not the exception. And reconciliation is lived through accountability, equity, and respect in every patient encounter.
Thank you, Laureline. Yeah, thank you. So the calls to action 18 to 24, they're all under the health calls to action. So those are good ones to remember to even post in your healthcare center or in your staff room even, just to remind everyone, right, that we are still working towards reconciliation. I just wanted to just go back to the chat really quick here. We had some good comments here. So in Fraser Valley Health and the VCH during onboarding, there is a mandatory Indigenous cultural safety training. So that's amazing. That's good to hear, right? So we are seeing movement even from when I pulled that article. Someone asked about the nurse. I don't know if anything happened to the nurse in terms of the young Indigenous woman. I'm sure we'll hear something if something happens and it hits the news. Quebec has stated that cultural safety isn't necessary to teach, and that's really disheartening. So, we can see both sides of the spectrum, even, within our provinces, right, from the West Coast to Quebec. Because it would be nice to, or it would be, oh, and Muriel raised a hand. I'm just going to actually let her. Did you want to say something, Muriel?
If so, Muriel, you can unmute yourself.
No, sorry, I made a mistake. I pressed it by accident. Sorry.
Okay, no worries. Like I said earlier, it's really important, right, that we make sure that we hear each other, we allow space for us to share our comments and our thoughts. So yeah, no worries at all. Um, Quebec is the only province where the premier declares that there is no systematic racism. Yet we're at the 5th anniversary of the Joyce Echaquan's death. Still a long ways to go, absolutely. Um, Training as a RN, graduated in 2001. University College included a good amount of Indigenous training, including going to a First Nation community, going to a longhouse, multiple classes. Yeah, I believe one of the associations, actually, it is mandatory in the association and to do Indigenous cultural safety. So, I mean, we see that there's there is movements. Ethel, how can I get a copy? They're all going to be on we have a YouTube channel with all of our stuff, and Elsie can put a link to that in the chat. Oh yeah, she did already. Way ahead of me, way ahead of me. The First Nations Health Authority BC mandates the cultural safety training and has monthly cultural safety and humility webinars for all staff. Amazing. So some really good work. So this, I always thought when I think of reconciliation, uh, it's like an iceberg, right? We have our land acknowledgements, our public apologies, recognizing Indigenous days, courses on cultural safety, learning the history of Indigenous peoples and colonization. But really, when we get deeper, and that's why we did this series, right, is really understanding the intent of the treaties, the real legislation and the policy, so we can really reflect back on the policies that exist right now in terms of how we practice safely, practicing cultural safety and humility, cultural awareness, cultural intelligence, reframing. And that's a whole nother course that we do on reframing. Two-eyed seeing, very important, right? That we need to make sure that we're looking at things from both sides, engaging in difficult conversations and educational awareness, respect for that self-determination, practicing trauma-informed care, and then policies that really reflect this type of practice, right? And committing to that lifelong journey of allyship. Um, so in looking at this and thinking about reconciliation, what does it look like to you? What does it feel like to you in terms of where you work? Um, you'll start to see some real, is that deep reconciliation that's, going to be long lasting? Or is it, just a checkbox, right? We often see that in some agencies, right, where they do a land acknowledgement, but they don't, and it's read off, um, but is that doing a land acknowledgement? Is it in policy, right? So we can often look at our practices. Are they in policy? I worked for an Indigenous agency in just north here in Dauphin, and within the policies, they had, paying an elder, right? How they start their meetings in terms of the prayers, right? So the practice was actually in the policy. We don't often see that in all organizations, but it's really nice to sometimes look at the policies and ensure that it's actually reflecting the practices that we say that we want to change, right? Um, so we're gonna move on because otherwise you guys will be here for another hour and a half. So types of allyship. So we have, passive bystander where, something might happen and they might just turn a blind eye, right? The performative where they're going to do it because they're supposed to do it. The active where they're actually actively engaging in reconciliation items and they're looking at what else can we do, right? And there's just the no interest, right? It doesn't concern them, so that they don't even think that they need to do anything. So we're gonna move on to This is just a framework matrix, just a way to kind of view maybe where you're at, or certain situations maybe fall within a certain area, right? So we can look at, you know, the intent to create culturally safe spaces. It needs action, and it also needs a deep understanding of Indigenous knowledge and understanding. Okay.
So in the nature of time, I'm going to go through this fairly quickly, but what are the barriers to reconciliation? You know, that institutional resistance that Victoria just spoke about with policies, and, you know, that lack of real commitment to making sure that there is change. Tokenism, again, just like, you know, the land acknowledgement is just a token that you have to do. It really has to have some meaning. Lack of Indigenous representation, misunderstanding of history, and personal biases. We did have a session on personal biases, and you can go back if you missed session 2, and it talked a lot about the biases that we do have. So in the nature of time, I'm going to continue on here in Victoria, hand it off.
So so really a path forward is just, you know, committing to action, right? Committing to action and continuous learning. Next slide. Reconciliation in healthcare, creating that awareness, the acceptance and the engagement, right? Engaging Indigenous people, you know, accepting kind of where things are at now, and committing to change. And I have a couple of slides of self-reflective questions that we'll just put up for a second. So in the YouTube, then at least people can have a look at and answer these as you kind of journey on your reconciliation journey. And then I have some recommended readings. Some of these are the same as in the other sessions. There is one challenge here on the next slide. If you're really looking at changing, or really want to challenge your thinking, Me and White Supremacy, Combat Racism and Change the World and Becoming a Good Ancestor by Layla F. Said. Really good book. I read it, really changed also my perception of certain issues and things. And for all those of you that attend 4 sessions, you will receive a certificate of attendance via mail. Just kidding, email. It's a ministry. Okay. And here is our survey. Please take the time to fill it out if you have a minute. I know we are like a minute over, and there was quite a few people that had to continue on to other Zooms. I just want to say that Miigwech, I appreciate each and every one of you for the time that you spent with me and Laura Lee today, and the time that you have spent, you know, tuning into the other sessions that we hosted. So Miigwech, thank you very much, and I hope that you guys all have safe travels wherever you may be going. Here is some of our other social medias that you can check out, as well as the YouTube channel where you'll find the sessions, as well as the Indigenous History Month sessions. So thank you, everyone.
Elsie did put the link to the survey as well, and thank you for joining us today.
Yeah, thank you so much. Have a blessed day, everyone. Take care.